Hi, I'm Dr. Joel Kopelman. I'm an oculoplastic surgeon. Today we're going to review a video by Dr. Dray, who's a board-certified dermatologist, and she's put out some very good videos on cosmetic procedures. However, this one on how to fix droopy upper eyelids is one that I'd like to comment on because I think some of the points she makes are good, but there's a number of points that don't make any sense, frankly. So let's listen together.
Hooded or droopy eyelids are the result of age-related change to the face. You guys know that as we age, we lose collagen in the deeper layers of our skin and elastin, and that results in saggy skin. But the other major factor that goes into play with the aging face and droopy eyelids is loss of bone, redistribution of fat, and redistribution of kind of muscles that ultimately also contributes to the appearance of droopy eyelids.
I agree with that. I think that as we age, there is laxity of this tissue surrounding our eyes, and that includes the skin, the muscle, and bulging fat. And all those factors can contribute to what appears to be droopy, hooded eyelids.
So it's more than just losing collagen in the deeper layers of the skin. It's just kind of a restructuring of the facial anatomy and the anatomy around the eye. However, some people are born with naturally hooded eyelids, just secondary to their facial anatomy. And so they may be bothered by this at a younger age. It has nothing to do with age-related change to their face. In some cases of hooded eyelids, it's so severe that it impacts the individual's vision, especially like their peripheral vision. The hooded eyelids can actually weigh down the upper lashes and compromise your visual fields, and it also can lead to a lot of headaches. Procedure number 1 is an upper lid blepharoplasty, or basically surgery or a lid lift. Of all the procedures I'm going to chat with you guys about in today's video, this is the most invasive. It is done under local anesthesia.
So upper eyelid blepharoplasties or upper eyelid lifts, as she calls them, they are not particularly invasive. It does require an incision on the eyelid and removal of skin, sometimes a little muscle and a little fat. It's not deeply invasive, however. It is commonly done and done both under local anesthesia as well as intravenous sedation where you go to sleep. So there are two different ways of doing it.
Blepharoplasty involves removing excess skin, bulging fat, and lax muscle tissue from the eye in order to correct the droopy hooded eyelid. The procedure runs $2,000 to $5,000, but if you are somebody whose visual fields have been impacted by your droopy eyelids, your insurance might actually cover a portion of the procedure. But there are actually no real contraindications to this procedure.
I disagree with that. There are contraindications to this procedure. Patients who are on blood thinners and they cannot stop those blood thinners, for instance, cannot undergo surgery safely on the eyelid because it's very vascular and they may have significant bleeding. So there are certain medical conditions in which we would not recommend a upper lid blepharoplasty or cosmetic eyelid surgery.
Now, as with any surgery, of course, there are the potential risks of complications. No surgeon worth their weight would ever tell you, oh yeah, this surgery is complication-free. There's no such thing. So your surgeon will chat with you about potential complications. They're probably going to mention the most common complication from this procedure is uneven folds, folds that are inappropriately too high or too low. And this complication actually is correctable by having a second surgery. Some patients experience something called lag ophthalmos after the procedure. That's basically an inability to completely close the eye. And this can happen if too much tissue is removed. It can be a temporary thing, however, and it can resolve on its own. And there are some measures that, could be recommended to mitigate some of the symptoms of not being able to close your eye fully. You may not even really notice it, but with time that could lead to dry eyes and problems with the cornea. Some people experience what's called ptosis or droopy eye after the procedure. That actually typically resolves after about 3 months.
Ptosis is not a common result of the blepharoplasty itself. Ptosis, which means actually where the eyelid is drooped like this, not the skin externally, but the eyelid itself is drooped. is commonly missed prior to the surgery and then is revealed after the surgeon removes the external skin. They see the ptosis and they think that was induced by the surgery itself, whereas in fact, most of the time, this ptosis preceded the surgery and it was missed during the initial evaluation of the patient.
People who are more at risk for complications from eyelid surgery are people who have chronic medical conditions, namely diabetes, high blood pressure, problems with blood clotting. When you see the doctor though and talk about if this procedure is right for you, they're gonna go over your medical history and they're gonna be able to counsel you on, the likelihood of these risks based on your medical history. So that's definitely an important piece of it. But I don't want you guys to be scared off from it, hearing these potential complications. If you are a candidate for this procedure, these risks are very low in the hands of a skilled surgeon. What can you expect after the procedure? Pretty much everyone is going to have some swelling after the procedure. The amount of swelling will vary from person to person. Your surgeon will likely advise you to do the following: to apply cold compresses to the eyelids for the first 24 hours. After the first 24 hours, you have a 24-hour period in which you do nothing, and then the third 24-hour period, you are going to apply warm compresses. Your surgeon will also give you an ophthalmic ointment to apply to the incision 3 times a day for about a week. In 90% of cases, the swelling that you're going to experience will resolve within 4 or 5 days. Overall, it's about 2 weeks of downtime after the procedure, and you will have to follow up with your doctor after the procedure with the surgeon to have your visual fields assessed, see how you're healing, all of those things. So it is a procedure with a bit of downtime to it. The results that you get from a blepharoplasty will last about a decade. It's not going to stop the aging process, however, but it definitely will correct what you have at baseline, and the results last a good chunk of time. Of all of the procedures I'm going to talk about in this video, blepharoplasty is the one that, while it's the most invasive because you have tissue cut out, and while it's more costly than some of these other things, it definitely yields the most drastic results, the most striking results, I'll say, and the results are the most long-lasting of all of these procedures. Blepharoplasty is appropriate for people whose droopy eyelids are moderate to severe, especially if you have symptoms of headache and it's impacting visual fields, peripheral vision, then blepharoplasty. But if you have very, very mild droopy eyelids and you just want some rejuvenation, is there anything less invasive, less costly that you can pursue? Yes, absolutely. Number 2 thing that you might think about or discuss with your ophthalmologist, or plastic surgeon, or your dermatologist is something called a thread lift.
Dr. Dray is confused here a little bit because a thread lift really does not apply to an eyelid procedure. A thread lift is generally used to tighten the face or tighten the brow, but rarely, I've never even heard of a thread lift being done on the eyelid itself.
It is a non-invasive treatment in which basically sutures, stitches are placed under the skin. These are dissolvable, and no tissue is removed, meaning there's no cutting, there's no excision of skin, fat, muscle. And the sutures are put under the skin, and they are basically used to tack up the skin, just underneath the skin.
As you can see from Dr. Dray's image where she puts her fingers on the side of the eyelid, it's not a thread lift of the eyelid itself. It's trying to raise the brow with a thread lift, which, by the way, is only a temporary fix. It is not a permanent fix, and can just temporarily, for a short period of time, maybe a year, raise the brow and pick up a little of the extra skin that's hanging down. But it's not a thread lift of the eyelid itself.
What this ends up doing is 2 things. It temporarily, lifts things up, but the threads themselves, they provoke a healing response, which ultimately leads to an increase in collagen production. Because it stimulates an increase in collagen production, what you can expect with a thread lift is a very gradual, ongoing improvement in skin firmness. It's not as though all of a sudden overnight your skin is going to be firmer. You have to wait for the collagen induction to occur. But with time, you will start to see firmer skin. And when it comes to the upper eyelid area, you may, slowly begin to appreciate less of a redundancy there without saggy, droopy eyelid.
Again, the sutures Dr. Dray is referring to create a inflammation and secondary micro scarring along those threads, which creates that sense of firmness. It's not like a positive thing in terms of laying down new collagen necessarily.
The thread lift is a very low risk procedure. There's no risk of like scarring or bruising or bleeding.
It's obvious that she doesn't do thread lifts because thread lifts can lead to bruising, scarring. The threads themselves can spit and become externalized. There's certainly potential complications with thread lifts. They're not totally without side effects.
I mean, they're just putting sutures under the skin and anchoring the skin up. And then with time, you get that increase in collagen production that improves skin firmness. However, the lift that you get with a thread lift, it's only like 1 millimeter. So it's not the best option for people whose droopy eyelid is moderate to severe, especially, if you're in that category again, where it's impacting your visual fields, then a thread lift is probably not your best bet.
So 1 millimeter difference is not worth the risk of putting a thread in the face, if that's what she's suggesting. If she believes that it's only a 1 millimeter is that little lift, it's certainly not worth performing that procedure, especially since it's a very temporary improvement.
This is something that tends to be a better option for people, again, who have a mild droop and are younger, maybe in their 30s. Whereas a blepharoplasty might be something that you might want to consider in your 40s or your 50s, and especially if you have a more profound droop. A thread lift lasts about 3 years, so it's not permanent. It's not a permanent result. Nothing that I'm talking about in today's video stops the aging process. But it's a very quick procedure, less than an hour, and the downtime is much, much shorter than with surgery, just 2 to 3 days for recovery. You can expect some swelling, but beyond that, very short downtime. The next option for rejuvenating the look of the upper eyelid is going to be a resurfacing laser treatment. Now, this is less well studied in like randomized trials in comparison to blepharoplasty, and it's certainly nowhere near as involved or invasive, and it's not going to yield as dramatic of a result, but it definitely can tighten the upper eyelid. This is a better option for those whose droopy eyelids is merely due to saggy skin. And there's no issue with, excess fat contributing to the droopy eyelid, because with the CO2 laser, what it's going to do is stimulate collagen production in the deeper layers of the skin. And so that's really only going to help with the skin tightening piece of things.
Dr. Dray is suggesting that resurfacing of the upper eyelid with a CO2 laser is a good option. I don't believe it is, because the thickness of the skin of the upper lid is very thin. CO2 laser, which is called a carbon dioxide laser, penetrates much deeper into the skin, and I would not recommend a CO2 laser for an upper lid skin tightening procedure. It's rarely used by oculoplastic surgeons to tighten the upper lid without also performing the upper eyelid blepharoplasty. So it's just used as an adjunct in patients who have significant skin damage or wrinkling of the upper lid that can't be accomplished with a incision and removal of a strip of skin itself.
It's not going to address the fat. If a portion, if part of what's going on with your droopy eyelid is redundant, is lax muscle or fatty tissue there, then that's going to be That's going to be surgery that's going to correct that, not a laser. Now with resurfacing lasers, you do have downtime. There is a risk of post-inflammatory hyperpigmentation. Preoperatively, we can kind of prep the area by prescribing hydroquinone and tretinoin. Both of these can reduce the risk of post-inflammatory hyperpigmentation with resurfacing laser.
Dr. Dray is recommending a retinol and hydroquinone on upper eyelid skin. This is not a good idea. Those two products, first of all, can melt and actually get into the eye, which would be very irritating to the eye itself. So that is not a good idea. You can do it on the lower lid because by gravity that cream can drip down over your face and won't harm the eye. But Retin-A or hydroquinone on the upper eyelid is not a good suggestion at all, and I would not recommend it.
And the other risk with resurfacing laser is milia forming. Scarring is a risk here, and then you have a risk of the lid retracting and not functioning properly. These are, rare but potential risks. With resurfacing laser, you have to assess efficacy at 6 months, because one thing that happens is you do get some swelling and it takes a while for that to kind of resolve. And so you may think that things are much, much better, but it's really just the accumulation of swelling there. Once the swelling has gone down, you can really get a sense of the improvement that you are going to expect with a resurfacing laser. This is not a permanent solution, it's a temporary kind of fix, but it definitely can rejuvenate the look of the upper eyelid, namely by tightening the area and smoothing out textural irregularities. There are some newer energy-based devices, namely radiofrequency and Ultherapy, that are used for skin tightening that show promise in rejuvenating the look of the upper eyelid. The way these work is they deliver heat to the deeper layers of the skin, creating kind of controlled areas of micro-injury that stimulate healing, collagen production, and ultimately can lead to a skin tightening effect. So that's desirable for the upper eyelid where you have some saggy skin.
Dr. Dray has considered the idea of using Ultherapy or microneedling as a way to rejuvenate the upper eyelid. This is misinformation. Ultherapy will penetrate through the thin upper lid skin too deeply and will actually injure the eyeball itself and jeopardize your vision if you use Ultherapy on the eyelid itself, and microneedling as well. I think she's referring to tightening the forehead area to raise the brow, which will potentially give a rejuvenated look to the eyelid. But when she loosely recommends Ultherapy and microneedling for the eyelid, that's absolutely wrong and potentially dangerous.
Examples of radiofrequency devices include Illuma, LuxIR, and Thermage. They take about 15 minutes, relatively painless, no downtime. The results are pretty modest, I would say, not very striking. But again, if you have very, very, very mild droopiness, it may be an option for you and something that gets you the results that you're looking for. What about Botox? Botox actually is a temporary option to rejuvenate the look of saggy upper eyelids, especially in people whose sagginess is very, very mild. I think this is a better option for people maybe in their 30s as opposed to those in their 40s or 50s because it's really just kind of temporarily lifting things up. It's commonly referred to as a Botox brow lift. Very low risk, but again, it's not a permanent fix whatsoever.
Botox can, if you inject these muscles here, which are the depressor muscles of the brow, they can raise the brow by inhibiting the contraction of these muscles which pull the brow down, which then in effect may raise your brow slightly and give you a sense that you're improving the hooded upper eyelids. That's true. But again, it's not an eyelid fix. It's really a brow treatment that's secondarily improving the appearance of the eyelid.
If you are just bothered by the appearance of the beginning stages of droopy eyelids, then this might be something that you would be happy to have and enjoy the results. With Botox, results can last, up to 6 months, and then, you get repeat injections.
The effect of Botox only lasts 3 to 4 months. It does not last 6 months. That is a misinformation, again, conveyed by Dr. Dray. Botox does not last more than 3 to 4 months, and 6 months is beyond the limits of what Botox can achieve. I want to reiterate that it is important to get the facts straight, okay? Because sometimes hundreds of thousands of people look at these videos and walk away with some information that is not accurate. I think it is important to clarify truth from fiction. I know many of you are not doctors or nurses, and therefore I feel it was important to react to Dr. Dray's video on hooded upper eyelids so that you're not misled in terms of the information that she conveyed. If you have any questions or comments, please leave them below. Subscribe to my channel, and I'll look forward to seeing you in my next video.